the real patients being treated, in fact. So as a background of the study, or before that, I would like to give you a little disclaimer about it. There is nothing about the disclaimer other than that I have an association with a nonprofit organization. These kids who are STEM students, help them to collect this data and convert that into research studies. And so far, last 15 years, all these kids have become a doctor. So let's go to the next here. We have to present this, not touching. So the biggest problem, the biggest blessing what we had is the CGRP for my migraine patients, the CGRP antagonist. And CGRP antagonist, when it came, obviously, these were patients diagnosed with the migraine headaches, episodic and chronic migraine. And we were given the injectable, first time it came with the injectables. After almost 2 to 3 years of exposing the patients to this injectable CGRP antagonist, we found, or the FDA came out with a warning of high blood pressure. We started wondering that did we cause any harm to our patients? So we started looking back into the data. And this is how this study was created. So we compared the incidence of a hypertension across the different CGRP antagonists, which my patients were exposed to. And let's go to the next. So the data here is we have variable extraction from the demographics. We have exposure to the classifications. We have the EMR extraction from the data. And we have a statistic analysis, the design of the data. Now, exposure and classification to the key variables we had. The most important thing in this category is that we had exposed our patient from the age 16 to 95. And the total patient population, male to female ratio was 125 to 473. And the BMI was 17 to 62 almost. Now, pay attention to the comorbidities on these patients. The hypertension group, the patients who were previously diagnosed with the hypertension were 87. The patient with diabetes were 7, CKD were 3, their post-stroke were 3, and the treated and untreated obstetric sleep apnea of 49 and 87. So the blood pressure measurement was taken at baseline, which is at the present of diagnosis, 0, 3 months, and 6 months follow-up. The derived variable were the mean arterial blood pressure, systolic blood pressure, and the route given injectable were 121, oral were 477, and combination was 89 subject or patients. And you can see that pretty much they were exposed to all the GPANs as well as the MAPs, the CGRP. The key insight on this was very, very significant here, that the mean systolic decrease in the blood pressure for the patient with the prior high blood pressure. So the patients who already have diagnosed with the high blood pressure, the mean was decreased rather than increased here in our data to almost 3 to 4 millimeter of mercury, where in the no prior hypertension group, there was slightly increase in the systolic blood pressure up to a 4 millimeter of mercury. But there was a different trend we saw that in first 3 months, there was an increase in blood pressure, and then afterwards, there was slight decrease in the blood pressure, the mean systolic. In fact, the diastolic still stays the same. The Kaplan-Meier cumulative incidence data for over 6 months. Again, the curve plateau after 6 months, after 3 months, confirming the early onset pattern of this disease process. And this is mostly in the no prior blood pressure or hypertension diagnosis patient. So the systolic blood pressure trend, prior hypertension group, if you see that, their blood pressure decreased rather than increased with the CGRP, which is against the FDA warning, which was very interesting observation we had. Now, with the patient with the no prior hypertension, if you see that again, there's first 3 months, there is an increase in the blood pressure up to a 3 to 4 millimeter of mercury, but it further comes down. And mostly it was seen in the systolic blood pressure, not in diastolic blood pressure. Diastolic blood pressure was still flat. So again, this is compared to the both group over 6 months. The top one is the prior blood pressure, and the bottom one is with no prior blood pressure or hypertension diagnosis. So the key finding of this is the prior hypertension is stable to improve after the CGRP treatment. Now, in the normotensive or the normal patients with no high blood pressure before, there was a modest rise in first 3 months, and mostly the systolic blood pressure, not the diastolic blood pressure. Conclusion. So, no blood pressure worsening in established hypertension patients, obviously, but in the patients with the normotensive high blood pressure, there was a slight increase for first 3 months. That means that we need to be observant about the patient, and we need to still monitor the patients in first 3 months of the initiating any of the CGRP therapy. Obviously, this is not a double placebo controlled trial. This is just an observational study, what we did that. So there is a limitation for this study, but this is our clinical data on our patients, which I'm happy to report to you guys and help you guys to treat your patients. Thank you.
Thank you so much. So would you see some patients who need blood pressure medications first, and then you have to follow up with them and maybe check if they can be decreased or taken off, or you watch and wait? How do you manage blood pressure in clinic?
So the patients who had a prior high blood pressure, they were already on the blood pressure medication. And my observation has been that, or my conclusion has been that the blood pressure, the chronic migraine or the migraine headache was contributing to the high blood pressure. That's why their blood pressure got better. And so we didn't change any of these patients any blood pressure medication.
So to follow that, did you ever, when you measured the repeat blood pressure, did you check to see that migraine factor?
A very good question. So most of the patients who had visited the clinic on the first 0, first month, 3 months, and 6 months, none of them time they had high blood pressure. So they were not measured at the time of blood pressure. Sorry, high blood pressure. Migraine headaches. Yes, yes, yes.
Well, it sounds like good news.
Yes, this is a blessing for us. Otherwise, it was a nightmare for us now, because remember, we had the triptan where we cannot give it to the hypertensive patient, risk of a stroke and migraine, I mean, a stroke and
Uncontrolled.
uncontrolled. But now I'm very comfortable treating my patients without, oh, you have a high blood pressure, do not worry about the warning, because I have a data to prove.
We have more data now, so we just check and make sure we follow.
We are still observant for the first 3 months to look for the slight high rise but it's not significant that it should be treatable. But it's still, we are observing first 3 months. We tell the patients, and we also sometimes tell the patients that if you can do the blood pressure at home first 3 months, we also do that.
That's great. And I noticed that on your diagram, you actually had different lines for different medications. Are there some medications that you more watching than other for blood pressure increase?
Well, it was more slightly more towards the injectable than not injectable oral. We have seen that, but otherwise it was again it was not significant
Right.
between comparison to all the medication. Thank you.
Thank you for that. Great. Thank you.
Yeah.